In this video, we will be talking about B-complex vitamin C 20 mg, 5 mg, 2 mg, 75 Mcg Chewable tablet multivitamins. This product is a combination of B vitamins that are essential for treating or preventing vitamin deficiency due to poor diet, certain illnesses, alcoholism, or during pregnancy. B vitamins are important for the body and help keep you in good health. They include thiamine, riboflavin, niacin/niacinamide, vitamin B6, vitamin B12, folic acid, and pantothenic acid. Some brands of B vitamins also contain ingredients such as vitamin C, vitamin E, biotin, or zinc. It is important to consult with your doctor or pharmacist if you have any questions about the ingredients in your brand. The daily dosage of this multivitamin can vary depending on your individual needs, so it's best to consult with a healthcare professional to determine the right dosage for you. It is typically recommended to take this multivitamin with a meal to help with absorption. When taking this B-complex vitamin C 20 mg, 5 mg, 2 mg, 75 Mcg Chewable tablet multivitamin, it is recommended to take it by mouth, usually once daily or as directed. Make sure to follow all directions on the product package. If you have any questions, it's best to ask your doctor or pharmacist for guidance. If the brand you are taking contains vitamin C, it's important to take this medication with a full glass of water, unless your doctor advises otherwise. If you are taking chewable tablets, be sure to chew the tablet thoroughly before swallowing. For extended release capsules, swallow them whole without crushing or chewing, as doing so can increase the risk of side effects. If you are taking a liquid product, use a medication measuring device to carefully measure the dose, and do not use a household spoon. Some liquid products may need to be shaken before each dose, while products containing vitamin B12 may need to be placed under the tongue and held there before swallowing. It's important to follow the label directions carefully to get the most benefit from the medication. Taking this medication regularly at the same time each day will help you get the most benefit from it. Remember to incorporate it into your daily routine to ensure its effectiveness. If you experience mild upset stomach or flushing after taking B-complex vitamin C 20 mg, 5 mg, 2 mg, 75 Mcg Chewable tablet multivitamins, don't worry. These side effects are usually temporary and should go away as your body gets used to the product. However, if these effects persist or worsen, it's important to consult your doctor or pharmacist. It's important to note that if your doctor has recommended this medication for you, they have weighed the benefits against the potential risks of side effects. The majority of people who use this medication do not experience serious side effects. Although it's rare, a severe allergic reaction to this medication can occur. Seek immediate medical attention if you notice symptoms such as rash, swelling of the face or throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of possible side effects, so if you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. As always, if you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking B-complex vitamin C 20 mg, 5 mg, 2 mg, 75 Mcg Chewable tablet multivitamins, make sure to inform your doctor or pharmacist about any allergies you may have. It's important to consult your healthcare professional if you have diabetes, liver problems, or vitamin B12 deficiency. If you have phenylketonuria, PKU, or need to restrict aspartame or phenylalanine, be sure to talk to your doctor or pharmacist. Additionally, if you have diabetes, alcohol dependence, or liver disease, be cautious when using the liquid form of this product due to its sugar and/or alcohol content. It's also important to let your doctor or dentist know about all the products you use before having surgery. If you are pregnant or breastfeeding, consult your doctor or pharmacist for guidance on using this medication safely. It is important to be aware of potential drug interactions when taking B-complex vitamin C 20 mg, 5 mg, 2 mg, 75 Mcg Chewable tablet multivitamins. This can affect how your medications work and increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include altretamine, cisplatin, certain antibiotics, such as chloramphenicol, certain anti-seizure drugs, such as phenytoin, levodopa, and other vitamin/nutritional supplements. It's also important to note that this product may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors are aware that you use this product. If someone takes too much of this medication and experiences severe symptoms such as losing consciousness or difficulty breathing, they should call 911 immediately. Otherwise, they should contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to keep all medical and lab appointments. This product is not a replacement for a balanced diet. Remember, it's best to get your vitamins from healthy foods. B vitamins are naturally found in leafy greens and other vegetables, meat, fish, poultry, and enriched breads/cereals. So, make sure to incorporate these foods into your diet to get the most out of your vitamins. And don't forget to keep up with your medical and lab appointments. If you are taking this multivitamin on a regular schedule and happen to miss a dose, simply take it as soon as you remember. However, if it is close to the time of your next dose, it's best to just skip the missed dose and take your next one at the regular time. It's important not to double the dose to catch up. As for the best time to take this multivitamin, it's generally recommended to take it with a meal to help with absorption. The daily dosage will depend on your individual needs, so it's best to consult with a healthcare professional to determine the right amount for you. Be sure to check the storage instructions on the packaging. If you have any concerns about storage, don't hesitate to ask your pharmacist for guidance. Keep all medications out of reach of children and pets. Do not dispose of medications by flushing them down the toilet or pouring them into a drain unless specifically directed to do so. Safely discard this product and it is expired or no longer necessary. Consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.